the NexoHair demonstration on servants. So typically what happens when we do a consultation in Svenson is it is so vital to know what type of hair loss a client has. So we would normally ask questions about their general health, the scalp hygiene, the typical lifestyle that they have. And my most favorite part of doing consultation is making that timeline, asking what year was the first sign of hair loss. So also a big part of our consultation is when we do the assessment through dermatoscope or a video microscope. That's when clients are really curious of what a normal hair would look like and what typical hair loss would look like under microscope. So after a consultation, we would give them the recommendation. So it's either we start them on conventional treatments or conventional therapies, or dependent on the typical hair goal that they want to achieve, we would recommend cosmetic options or surgical options. But personally, the NexoHair is an exciting addition to our Svenson's range of treatments. It's because I'm able to confidently say to the client to give it a chance before actually deciding to get a surgical option or a cosmetic option. Because from Sir Vince's history, we really jumped into the hair transplant option since there was no way to lower his hairline without a surgical procedure. But right now, exciting times for the brand because we're able to at least give them a chance to do a conventional one first.
We'll do the photos. Take a photo close up.
Yeah, and then we will show the before and afters of Servance's
In the coming months.
follicular unit extraction.
We do, but we do. I think what have you tackled are there do's and don'ts before the procedure, like for the hair transplant?
For hair transplant.
No, for here, because they would think it's something high tech as this. You cannot drink alcohol. Is this working? That way you can banter. That way, is it? No. So I think that's one thing.
They turned it down.
I think you can just toss them and then talk about the preliminaries, like no parties,
So one of the biggest things about the NexoHair procedure is that this has no downtime. So also at the same time, there's no discomfort of it drawing blood from your arm. So also there's not much prep needed before you are scheduled by the branches for a session.
I think, to be honest, there are not any much don't do's before. I would say maybe if you're on minoxidil or any other products, just refrain from using it the day of the treatment. And then mostly I think it's more important to just make sure that you're sterile post-care. So no wearing hats, no shampooing for about 6 hours. To make sure that, because we are microneedling, so we are going to create channels on the scalp for the exosomes to penetrate into the scalp. So for those holes to close up, it takes about 6 hours. So we're going to make sure that we don't wear hats, no shampooing. But I think the post-care is more important than the pre-care. Because again, Svenson has a protocol where the patient comes in, they will wash the patient's hair, and then we're going to sterilize with alcohol. So the pre-care, I think, as long as they don't just use any products, the day of the treatment, it's fine. But the post-care, again, because this is something that the patient will do at home, make sure that they follow our guidelines. And for the most part, it's, as Shai mentioned, it's relatively easy, and there are very little restrictions to the procedure.
So shall we start?
We shall begin. Any last words, please?
I just hope to get my forehead back because I've been a 5-head for too long.
So normally, in terms of results, since as a prep, we've seen patients that are very responsive respond as soon as 10 days. Usually, I would say responsive patients will respond and they'll see baby hair growth, changes to their hairline as soon as 10 to 14 days. On average, about a month, 2 sessions in a month. About 80% of the patients will see noticeable changes. And I've yet to see a case that was 100% unresponsive. So 100% of cases so far, all over the world, have seen noticeable changes to their hair line or their hair within 60 days and about 3 sessions, 2 to 3 sessions, depending on the issue.
And as a trichologist, the first few before and after photos, I was mind blown.
Right.
Because the results looked like they were touched up.
Right. So we had a very, very, I guess, fun experience. When we first met, I visited their Makati headquarter office, and we had some demos with the consultants and the therapists. And at the first demo, there's a little bit of static, but during the first demo, actually, I think she's a consultant for some of you guys that have visited the BGC Center. She's a consultant at BGC. She has hair loss issues on the top of her scalp. Very, very prominent. And after just one session, when we followed up with her, I would say exactly 10 days later. The treatment was on April 25th, and the session, the follow-up session, excuse me, was on May 6th, right? So about 10 days, and we were able to see noticeable changes. I mean, I think something comparable to maybe PRP after 3 sessions, right?
Correct. So that's the exciting part of it all. Fastest result I've seen in 11 years.
Exactly. So one of
without anything orally taken.
Right. And I think without going into the deep science, one of the advantages that Exosomes or E50 Exosomes has over traditional methods is that it can actually stimulate hair and follicle stem cells. So conventional treatments that you've had so far just make sure existing hair follicles grow healthy, thicker hair faster. However, Exosomes not only do that, but also stimulate the formation of new hair follicles. So simply put, conventional treatments will make existing dots appear faster and thicker, whereas Exosomes not only do that, but create new dots, right? That's why you're seeing faster cells. So as you see here, very, very comfortable. Right now we're using a microneedling pen. The depth is about 0.5 millimeters. So usually, I mean, there's only blood when there's the patient has acne or inflammation on the scalp. There will be blood from the actual acne. But usually when I do about 20 to 30 cases, there will be almost no blood. And usually on the top of the scalp, as you can see, it's very, very comfortable. Areas where there's a little bit, no hair on the hairline, there's a little bit of discomfort, but I wouldn't call it pain. It feels very similar to when you're using your nails and tapping the top of your scalp. It's very, very similar.
How does it feel?
It feels like you're like a massage, actually. It doesn't hurt at all.
So if you see here, there's just like slight bleeding, pinpoint. So I think there was a small, maybe an acne or inflammation right there. So, but as you can see, all the other areas, there's no bleeding at all.
So it was Sir Vince's hairline that was transplanted. So he did about 2,000 grafts, so that would mean 2,000 hair follicles on his hairline. So it's always nice to share that Exosomes would actually do that without the surgery. It's creating a new hair follicle without ever doing surgical procedure like follicular unit extraction.
I mean, I think these days, I mean, at the end of the day, of course, hair transplant surgery is great if you want to see, results that are, of course, considered transplanting hair. But I think these days, patients are sensitive to downtime, right? It's the downtime, they're very, very sensitive to it, especially after COVID. I think a lot of my hair transplant surgeons, colleagues that I have all across the world, they say their business is really plummeted because, now we're not working from home, right? So people really want to get out. And I think, again, as I mentioned over and over today, the E50 treatment, very, very convenient. To be honest, normally when I do it, of course, I don't like seeing my patients very long, so I usually do it in under 10 minutes, and I can get them out the door. 30 minutes, they can be in and out, so very, very easy and convenient.
That would take about 30 minutes to 45.
So at Svenson's, because of course, we have a program where you come in, you wash the hair, we sterilize and make sure that you have a step-by-step process. So we assume that the whole procedure will take under 45 minutes, anywhere between 30 to 45 minutes, which is something that you can do maybe on a lunch break even, if needed. And again, there's no downtime involved. Just to give you a story, I guess a personal anecdote, I've been going around all the branches besides the group, training therapists, and 2 weeks ago I received 4 treatments in 2 days. So, and I was okay. There was no, I went out to party that night on Friday. I live in BDC, so I went out to party, I was fine. I drank, it was all okay. So, easy, relatively pain-free.
Oh, yeah. Yeah, so Sir Vince is asking about his post-procedure.
Yes.
Yeah, no, I was asking because I'm old now, so basketball is in the past a bit, but I still play a lot of golf, and I was just asking about sun exposure. If I'm gonna play, you said 6 hours after,
Yes.
no hat, nothing, but after that it's fine, just wear the hat.
Yeah.
I'll just wear a bucket hat. So I'm playing tomorrow.
Yes, that's okay.
Just checking.
Yeah, no, that's okay. Just today, no shampooing. There's some hyaluronic acid. So exosomes are lyophilized, meaning they're freeze-dried. So during the freeze-drying process, we add some hyaluronic acid because that allows us to sort of preserve the structure. And the HA will make the hair harden a little bit. So I usually recommend before the product fully dries, style your hair. And if the patient is uncomfortable and they feel like the hair is too messed up, after the product is fully dry, gently rinse with water. Don't scrub too much, and they can re-style. And after that, if they want to style it with no products, blow dry, follow it. Yeah.
How about hair coloring?
Yes.
He also does some
Hair coloring, so I would, again, as long as it's not within the same week, I would say it's good. Week before the treatment, week after, yes. And again, most of the pre and post care has to do with the fact that we are microneedling. Yes, it's minimally invasive, but we are still needling these exosomes onto the superficial layer of the skin, so we just want to make sure that we keep the area sterile, free from any chemicals and contaminants. And also, of course, E50 is actually shown to even actually color. So if you have gray hair, you can actually create black hair also. So usually, gray hair that we get comes from the fact that our cellular pathway for growing hair has aged, and it's not a well-regulated pathway. That's why it grows white hair or older hair. But now, when you use E50, it will actually stimulate cells in our hair to properly regulate what's called the LVNT pathway, which is the major pathway for hair growth, and it will grow black hair. So your previous hair will be white, but the new hair that grows will be white. And of course, that takes a little bit of time. It's not, of course, for the white hair to fall and new hair to grow. It takes a little bit of time, but we've seen many, many cases where over time they've shown that their hair is growing.